what happened after 9/11, 2001? You were called to Washington. Do you want to tell just a brief story about meeting with the U.S. government on the war on terrorism?
I met with the Secretary of Health and Human Services at 7 p.m. Sunday night, and emergency meeting, and they'd gotten indication that there was going to be a second attack, and it was going to be biologic, and we assumed it would be smallpox as a very probable one. And we found we had almost no vaccine. We had about 90,000 doses, and that was produced in 1978. And so we talked with manufacturers, and they said we could produce it in 5 years. That's as fast as we could get going. There were no manufacturing capabilities at all. So this was a great adventure of bringing in what I thought was one of the best people in the country that I knew, and called him up and asked him to come in and what can we do. And between the two of us, I would say we broke more bureaucratic barriers than you can possibly imagine. And in 18 months, we had 200 million doses of vaccine coming in. We hadn't, at the time we had it, this is a story, it's not in the book, we actually went to see the Secretary, and we said, Mr. Secretary, you realize we are producing it in a different way, and the strain's a little bit different. We haven't put in people yet, but we are about to do that right now. But remember, we talked about this. If it doesn't work, we've got a lot of answering to do because we've committed more than $500 million. And I must say, he got very pale. He said, yes, you said that, but you said it would work. We said it was 95% certain it would work. But I just want to remind you, well, he was on the telephone every day, sort of, how are the studies going? And the studies worked all right.
And you before the talk, you made a link between that episode and the swine flu, which is going around the world right now, is that things end up arriving too late. Did you want to make a brief comment about that?
Yeah, in 1957, we had the pandemic of influenza, which looked very much like what we have this one, with when it started and everything else. And at that time, there was an heroic effort made to produce some vaccine, and which was done in only a few countries. At that time, we met with European manufacturers, and they really just said, we really can't, we probably can't handle it at all. So we had some going in the U.S. Well, we looked at the course of the epidemic, and we did exactly what this one has done, and it's hit a peak along about October, late October, and then gradually vanished. And about that time was when the vaccine came along. Obviously had nothing to do with the end of the epidemic at all. And so we were out vaccinating a lot of people, but the epidemic was at an end. And I can't imagine that 52 years later, and all the efforts we put into it, all the advances in technology, here we are again. The vaccine is coming in. We're peaking in the epidemic at this point. And guess what? We're going to get the vaccine just in time to say the epidemic's over.
I'll take that as reassuring.